Sorry, I wish I had some music for those who are entering the room. We can't see you, but we know you're entering the room. So we will pause for a moment and we'll get started as more people join. Thank you for joining and thank you for your patience. All right, Koya, thank you. Danita. Shout out to Danita in Georgia. Feel free to chat any reflections in the or share any reflections in the chat from the earlier sessions, those powerful sessions. Forgive my voice today. About days, my voice is acting up. Amazing opening, election of the officers. You know it, Danita. Thank you. Right, maybe give it about 5 minutes, team. Let's see who comes in the room. Welcome to the room. Please add any reflections that you have from either yesterday and that wonderful day we had yesterday for the annual meeting, and today with the earlier session with the meeting the ambassadors, the elections, and of course hearing the amazing, powerful Denise. Four minutes passed. We'll give it one more minute, and then we'll get started. But once again, please continue to use the chat. And just so you know, we're going to ask you to use the chat several times today. So we're really going to ask people to use that. And I'm not sure. I know we still have tech here, whether we can unmute folks to share verbally. If not, we'll probably have to use the chat for most of our interaction. We should try to make it fun if that's the case. Here we go. Here we go.
Hello, my name is Anna Pavan, and I'm a community health worker for the Department of Public Health in South Carolina. I was having technical difficulties, so I'm unsure if you guys had said something for us to introduce ourselves or something like that, or I'm way off.
Yeah, well, listen, you're good. You're good. We will get there. We actually were waiting until 5 past the hour to get started because we knew folks were joining. So we're going to actually officially get started. But I was making the announcement to please use the chat. Every step of the way, we want to interact with you. So you'll be able to go off mute. We ask questions and give some reflections, but we will be using the chat as one of our primary ways to communicate and connect. So I want to welcome everybody to this room, into this brave space, this safe space. Aloha to Denisha. Mahalo. And so I want to welcome you, and we'll start. Yes, I want to, yes, Cynthia, excellent. So whenever you're ready, Michael, we can start with the slides. And welcome everybody. So again, we welcome you to Unity 2024. It's a virtual conference, but we're going to try to make that connection that is so paramount to CHWs, that connection we have to one another. We're doing that virtually, and can't wait for next year when we can do it together. Our session is entitled Using Personal Stories to Amplify the Impact of Community Health Workers. As you know, this theme is about the voice of, respect of, and value of CHWs. So our session will really be right within that and really focus on some of those elements of who we are as a workforce, as well as who our allies and partners are. So there's a place for everybody here. There will be a few presenters and a few assisters with us today that will introduce ourselves in a moment. And I just want to say, as CHWs, allies, and supporters, and policymakers, and others who may be in the room, our stories are important and critical for many reasons. And we're going to explore some of those reasons during this session. Next slide, please. It's our hope that the information that we'll be sharing today will help us better understand the role and context plays in our life, in our journey as CHWs, our journey as CHW allies, and some of the other roles represented today. We'll define some of the aspects of a personal story, some of the ways that people share personal stories, and we'll really explain its use as a health communication tool and how powerful personal stories are and have been in advocacy and policy development. And before we close out the session, we will ask you to think about a few happenings, activities during your journey as a CHW or as an ally that can be used to craft your personal story in a very meaningful way. We will share stories. We share our stories for many reasons. When working with clients, we may talk about some of our shared lived experiences to kind of assist and connect. When presenting in meetings like this and conferences and trainings, we might tell our story to help teach, educate about our role to various audiences, and we tell our story during advocacy and policy development activities. As personal stories are powerful, and you will hear from many legislators and policymakers that personal stories have a powerful impact. They will thank you for the data and say, oh, that's, but they will talk about the fact that they will not forget the testimony from that client, from that CHW. So we want to underscore how important it is and to never downplay the critical importance of your story, highlights of your walked and lived experience to others. Next slide, please. Now, you're going to hear from some presenters, and we also have some folks that will be helping us with some polling and behind-the-scenes work. And so I'll give an opportunity for folks to introduce themselves. You've heard from me so far, and in a moment you'll hear from my awesome co-presenters. My name is Durell Fox. I might have met some of you yesterday. I'm one of the natural founders. I'm a longtime CHW, and I'm a senior technical associate at JSI Research and Training in their Atlanta office. And I'm going to tell you more about my journey later, so I'm going to pause and pass the microphone over to Rachel, who will introduce herself and tell you a little about her story. And pass the mic to Mike. Back to you, Rachel.
All right, thanks very much. Hello, it's a pleasure to see everyone today. My name is Rachel McCloud, and like Durell, I am a senior technical associate at the Atlanta office. And so it's great that we're both here, and I see some people from Atlanta on the chat already, so welcome. I've had over 15 years in public health research and practice, and I've really focused my career in health communication and health education, just because I've been so inspired by a lot of the work that CHWs do and a lot of that need that you see in the community, especially when it comes to being able to vocalize and understand different health information, speaking with doctors, understanding and acting upon health information. So a lot of my public health career has kind of been on how do we get these messages across and how do we work in communities. And so when I joined JSI and I was able to join this project, it was just such a natural fit because I have such deep appreciation for all that CHWs do. And I've worked in community settings across the country and just see how important these linkages are to really connect people with their health services and with other services. And we'll talk more about those stories today. And I just want to say I really look forward to hearing everybody's input and how you contribute to how we're thinking of personal stories and your own experiences. So thank you for being here today, and I look forward to speaking with you more later. I'll pass it over to Michael.
Hey everybody, Michael Chen here. Sorry, I'm coming in and out of video a little bit. I think part of it is trying to figure out the Zoom details. So thanks for bearing with me. I have the distinct pleasure of working with Durell and Rachel. I am out of the Boston office, also working for JSI. I think I will say my CHW story is that as an immigrant who didn't grow up speaking English, at one point in my life, this is maybe 10, 20 years ago, I actually started out my career as a community organizer in Boston's Chinatown. So helping a lot of the Asian community living there, navigating health and human services and helping them fill forms and going with them to appointments and referring them to different sorts of services in order for them to live healthy, productive lives. And so I'm really excited about this conference and the work that you all are doing, and just thank you for making time out of your day to spend it with us. And we're looking forward to hearing more of your stories and thinking about how we can use this communication tool to really elevate and center the voice and experiences of community health workers. Thank you. Oh, can I pass it on to my colleagues, Emma and Cynthia, as well?
Thank you, Michael.
Hi, my name is Emma Kay and I work at the JSI New Hampshire office. I'm going to be helping with note taking and all the things on the back end here at the Zoom. Happy to be with you all today.
Hi everyone, I'm Cynthia, also and based in the Boston office from JSI, and I'm also here helping with all the technical things and taking notes. So excited to be here.
Thank you so much, Michael, Rachel, Cynthia, Emma. Next slide, please. So here's a snapshot of our journey today, and we're going to weave this journey together. We're going to offer some thoughts, but we're going to be asking you for your thoughts as well. I'll first start with sharing some history of the milestones in the CHW movement in the United States. I'll start back in the 1960s, and you all can raise your hand if you want. If you were around in the 60s, I was born in the early 60s myself. But I'll do that, and I'll talk about that, and then I'll move to the current day and really share some highlights of our shared story, our shared experience as a workforce, but not just the CHW workforce, also our allies and partners have been a big part of our history of the movement of CHWs. And that history of the movement is critically important in our current day, particularly in our stories as CHWs and allies. The history of the workforce has taken on a more important role in the movement as we look to sustain the spirit and true essence of the CHW workforce as we explore opportunities to sustain our workforce. Rachel and Michael will then guide you through some activities to help in exploring your personal story as a communication tool that reflects who you are, that's maybe able to make an impact, that can inform advocacy and policy, ... More and more CHWs are engaged in that advocacy and policy development. We're also very much engaged in program development and evaluation. So we're going to discuss.
Entonces vamos a hablar de.
Oh, is that translation?
Yes, the translator just got in, but I need to be assigned as a translator.
Yeah, thank you. But they'll guide you to some opportunities to kind of reflect and explore your personal stories as a communication tool. And okay, so I'll go, sorry, I got thrown up over. We will also use the chat, and this is where Emma and Cynthia come in. We're going to ask you to kind of give us some inputs, and in real time, we're going to try to translate those inputs into some information that we will share on a slide and discuss and reflect on. So please be ready for those cues when we ask. And unfortunately, we're not able to provide breakouts on this conference platform. So we're really going to use that chat a lot. And you'll hear me say it maybe one more time. I'll try not to keep saying it. For highlights of your personal stories, anything you want to share when you get moved by a thought. And then we'll have some time to share verbally as well and reflect. And then at the end, we'll do some summary and key takeaway messages. And next slide, I think I'm going to pass the microphone to someone to talk about our next question.
Before we jump into this question, I see that Shonda actually has her hand raised. So Shonda, if you want to come off mute, we'd love to hear what your thoughts are or questions might be. Shonda, if you're able to hear me, or you can type it into chat as well. And then just an update on the Spanish translation. So Stephen, who's our technical help from the conference, is working on adding translation. So just a quick message to Alex, the interpreter, if you could please type into Zoom, into the chat, your email address. That way Stephen can add you to the interpretation feature.
I'm already here. Can you hear me? If you're okay, I just need to see the box that designates me as the translator, which I don't see anywhere. Let me see. There's usually a little. I usually get a little window at the bottom. That asks me to accept.
Could you send me your email address real quick so I can add you?
Yes, A Torres, ATORRES, IN as in Nancy, T as in Tom, ERP as in Peter at Gmail. A Torres Interp at Gmail.
Thank you for this commercial break. And this is how it goes, y'all. We're flowing. We got plenty of time. We got a group that I think we can manage the time with. So thank you. And I can go forth with these questions if okay. Otherwise, if somebody's going to take this, I can go. Okay. So hey, everybody, listen. We want to know who you are, and we know some of us who are part of networks and associations automatically put our stuff in the chat. So some of you may have already done that. But I'm going to ask everybody to use the chat right now to share your name, your agency, your role or title, and particularly number of years working as or with CHWs, and of course the state that you're representing today. If you can add that to the chat, we'll give everybody time. And we'll give you all some shout outs. All right. Carolina, Tennessee. And welcome to some new folks who joined us. Hopefully you can see the slide. We're just asking you to use the chat, put some information into the chat as we make our next steps.
Okay, you should be able to see that as an interpreter. Thank you.
Thank you. I think we can go ahead if everybody has that memorized as far as what to do. And we're going to launch a poll very quickly. Before Durell kind of introduces our program in a little bit more depth, just to set the stage and context, I think if we could go ahead and launch that first poll just to understand if people have heard of this program before, and just kind of get a sense. And if we can launch it and maybe show the results on the screen. I think we've got both of our questions up right now. I think we're mainly interested right now in this first question. Perhaps we can relaunch that poll to get the second question in a short while. But if you could go ahead and answer that first question, if you're familiar with CDC's CCR program. And if you're wondering what CCR stands for, it's the Community Health Workers for Resilient COVID Response and Resilient Communities. So if that name rings a bell, please feel free to answer yes. And we'll just give everyone a moment, and then maybe we could put up those poll results.
No.
Okay, I'm not able to see the poll results just yet. I'm not sure if we're able to share those on the screen or.
Yeah, hopefully everybody's had a moment to put an option in to vote.
Yeah, and we can just focus on that first question for now. You're free to answer both, but we'll kind of come back to that second audience question shortly. So Stephen, if we want to see the results of that, do we need to stop? Oh, there we go. Okay, looks like we have a lot of no or unsure. So that's good for you to know, Durell, as you take it away and give us a little bit more of an introduction.
Thank you. So if we, let me see, the next, yeah. So basically you have a team who are hosting this meeting who are from a CCR project. So CCR, as we just heard, stands for Community Health Workers for COVID Response in Resilient Communities, also known as CCR. It's a CDC-funded project that supports 67 projects across the country for 3 years, 2021 to August to this month, just for 67 projects. Some have got no-cost extensions, but that's where the CHWs are doing direct service to attain some of the goals I'm going to mention. It also includes 3 national centers, 2 evaluation centers, and 1 technical assistance center who have a 4-year grant. So we're going through 2025. And really the ultimate goal of this project is working on decreasing the effects and impact of COVID-19 on people and communities who are at most risk for COVID-19. We also, one of our goals is to improve the community's ability to respond to COVID-19 and also building resilience so that they can respond to future emergencies and pandemics. We are also engaged in deploying CHWs who have received training, education, technical assistance throughout communities that have been most affected by COVID-19. And there are hundreds of CHWs, FTEs supported by CCR around the country, including territories, tribal nations, et cetera. And another one of the focus areas is really connecting and referring people to community services. And that can be services for access to healthcare issues, signing up for SNAP or other kinds of benefits, supporting the social determinants of health, and giving referrals to social services. So those are the many things that are part of the CCR program. And we will be sharing a website at the very end of the slide deck that you will have as they share the slides with the link directly to the program. We can also drop that in the chat if we get an opportunity to. I have that handy and open on my computer. Next slide, please. So a lot of people say, well, wait a minute, we're in a room full of CHWs and allies, so everybody knows this definition. But as we weave this story and talk about the story, and everything that we share today really is part of our stories, either my story, the movement story, your story, other corporate center stories. And we want to show this slide as a reminder that even today, in 2024 August, and probably tomorrow in September 2024, we will have to continue to weave the CHW definition into our stories, especially when educating about and advocating for CHWs. This nationally recognized definition for CHWs in the US was developed by hundreds of CHWs with the leadership of the American Public Health Association Community Health Workers section. It's been critical for us to continue to share our community designated CHW self-determined definition, as many people still have questions about who we are and what we do. The national CHW definition has also been a unifier, as we've done some of our very important national advocacy. So once again, I share this and offer this as a way for you to include this in your story as you educate, as you share materials, and as you talk with people in different places. And anytime you have a question, anytime you want us to pause for a moment and reflect on something in the chat, please just raise your hand and we'll ask you to go off mute. Next slide, please. I'm going to take a breath and I'm going to take a sip of water because I'm going to take you through a journey through time. I'm going to tell a story of our collective workforce history. And this includes CHWs, allies, partners, community members, who are all part of the history of the CHW movement. As there has been efforts for centuries to erase, rewrite, and block access to history, it's really important that as we tell our stories, we understand our history as a people and who we are, our ancestors, our family roots, but also the roots of the movement of the CHWs. Very, very important. And that includes all of you who are at Unity, who are here to learn about, to teach about, and talk about our workforce collective history. And this is just a snapshot of it. And we're actually working with NASWA to develop a nice timeline and an actual history portion of the website for NASWA. We have limited time to talk today, so I'm going to walk through just a few portions of the story of our history dating back to the 1960s. And here's the one ask I have of you. As I share, I want you to think about each of those decades as I talk about the different CHW milestones. And think about some of those milestones that were in your personal journey. If you were around in those decades, those of you, shout out to children of the 60s, including me. But if you weren't around, I want you to reflect upon some of the things you've heard, stories or history you've learned about those decades. So with that in mind, take a breath. And now we're going to kind of walk through history. And what I'm going to share with you is a few slides that will talk about those milestones, but it'll also talk about what was going on in kind of popular culture. So with the first slide, which is the next slide, can anybody on here just tell me a moment, what is this popular culture icon on the screen? And I'd ask you to either put it in the chat or raise your hand, but I want you to tell me about what you think this is on the screen right now. And we can play the Jeopardy music if needed. Well, I can't see the chat. If anybody can see it, let me know. So this is Mr. Potato Head. And please use your raise your hand icon. Who remembers Mr. Potato Head? Or Mrs. Potato Head, which came much later. Use the raise your hand icon and reactions. All right, y'all. I'm trying to get y'all to be interactive here. Here we go. There's one. Ah! All right. So in 1964, Mr. Potato Head was not just introduced, but became this phenomenon. Everybody had to have it, similar to other things over the years. Cabbage Patch dolls, those who remember, and those of you who might be younger would know some of the more recent examples of things that people had to have. Next click. So another thing that happened that was major for the workforce was one of the first federal pieces of legislation called the Economic Opportunity Act, which actually had specific and earmarked funds for community outreach, for health education. And it was one of the first federal funding sources that supported community health workers, which at that time, we didn't have the title officially recognized in the United States. So there were about 70 different titles: outreach educator, community health advisors in the South. Different regions had different names. So this was a really impactful moment in the movement. And I asked you all to think about what else was going on in the world in 1964. Those who remember, it was a tumultuous time. So it was actually a good time to start connecting community members to care, to social determinants of health, and other things. We had a lot of things going on, assassinations, a lot of strife and turmoil in the world in '64. So it was a great welcome to have this funding to support people in the community, helping people in the community. And I'll have to get my pace going a little bit more as we go to the next one. Next slide. Who raise your hand or put in the chat, and anybody who can see the chat, I can try to open it up a little bit more. Please let me know if anybody can identify what this is on the screen, which was first introduced in 1968. Yeah,
The popular one, Durell.
Yeah, I can't open the chat for some reason, guys. Sorry.
Got a lot of answers. Big Macs.
Okay, yeah, there you go. Yep. First introduced to the world. And if people close their eyes, they can probably remember the jingle. And once again, that's why we put this here. This was something that no matter what part of the world you were in, you knew special sauce, lettuce, cheese, pickles, onions, all in such a bun. Remember that whole thing? Or maybe some don't, but I do. Next slide, please. So in '68, we also had one of the first documented federal programs supporting community health representatives, as well as one of the first, next slide, please. We had some of the first community health centers. And just for people who don't know about the community health center movement, the CHW movement has really grown up with the community health center movement. There's a gentleman named Dr. Jack Geiger who traveled the world and then came back and opened 2 health centers in '68, one in rural Mississippi and one in my old Boston neighborhood of Dorchester. That's how we talk there. And those health centers actually had community people trained to do outreach, to kind of go out in the area around the health centers and talk to people, educate people, but bring them in for health services. And so that was some of the first CHW programs we know of. And then the Community Health Representative Program was a federal Indian Health Services program that was really solid funding for community health representatives who are very tied to the CHW movement, and they're working mainly in tribal nations around the country and world. Next slide, please. Some of you might remember this. This in the 1970s, there were many things going on. One of the iconic things that happened was this. Do people recall this wonderful icon? Those who can, you remember some of the education they did. They did one important education piece that CHWs have actually tapped into when we do advocacy. And that is, yes, I'm a bill, and I'm only a bill, and I'm sitting here on Capitol Hill. Basically, with music and fun and a cartoon, they were able to go through the entire process of how a bill becomes law. And we've actually done advocacy trainings where we have shared that, because it's very basic and very simple. Yeah, there was conjunction, junction, what if. So this happened. And hit the next slide. Another critical thing happened in the national movement for CHWs. And that was a development of this group within the American Public Health Association called the New Professionals Primary Interest Group. And the Special Primary Interest Group in the APHA are these organic things that happen when people come together. And this group wasn't a CHW group to start, but it was people who cared about things happening in the community. And they created this New Professionals SPIG, people who were new to public health, who were not like the epidemiologists and all the other members of the public health world, and they developed this. And please keep me on time, guys. Sorry if I'm moving over. Next slide, please. Another critical one. I'm going to just give this one to you. This was in 1999, December 31st, 11:59. People thought the world would end. People thought computers would stop working. People were really concerned. But we had a bright star that year, and that was the very first Unity Conference. It occurred on the campus of the University of Southern Mississippi in Gulfport, and I am honored to be one of the few CHWs who's attended each Unity since the beginning. Unity, as you know, is why we're here today, and it's a very special place for CHW organizing, for us peer learning, peer teaching, and so once again, a very big year for our world. Next slide, please, and I'll move with these faster. There was a big strike in the writers for movies and for TV shows. So the first, reality TV show was born. Also that year, next click, we actually shifted and created the community health worker SPIG out of the former New Professional SPIG. So we basically have been organizing in those 30 years since the 70s and decided, we're now a place in the space for CHWs to come together to be part of the broader public health world. And so we did a lot of organizing, a lot of the national, state, local, regional organizing that occurred. Some of it was seeded by us at the CHW SPIG of APHA. Next slide, please. This was one of the first telegraphs ever sent by Western Union telegrams. When cash was set, this was one of the first time that happened. Also that year, next click, we created something called the American Association of Community Health Workers. Because we're not so good at history sometimes, some of you do not know about ACHWA, but ACHWA was actually the first national CHW association. It ran from 2006 to 2009. Myself and many of the NACHWA founders were part of it. We created some enduring materials like a CHW code of ethics and many other things that live on. But the bottom line is that was our first attempt to truly create a national association. And we disbanded in 2009. And do folks remember what happened in 2008 in the United States? There was a big crash. Many CHWs who were part of organizing ACHWA lost their jobs. Many other CHWs, many people, doctors, nurses, so everyone was losing jobs. Stores were closing. And for those of you who don't remember 2008, it was a depression. It was really, it was really a tough year. Anybody who wants to share any reflections from that, there were organizations that closed, they got notice on Wednesday that they had to close their doors on like Friday. And these were organizations that were helping with pregnant women. It was really devastating for the field and for people's access to health. Next slide, please. People remember this one. This was the first iPhone released in 2007. Once again, one of those things that all over the world, people just had to have it no matter what the price. Next slide, please. One big milestone for our workforce was one of the first federal national studies of our workforce, and it was the HRSA, the Health Resources and Service Administration study. Myself and many other CHW leaders we heard from yesterday, who were talking today, were part of this HRSA study. And this was one of the first studies looking across the country to say who CHWs were, what our roles were, and we had some work previously on that as well, and also where we were at, what our salaries were. This was really the first snapshot of our workforce in the country, and that informed much of our policy and many other things after that. Next slide, please. I don't know if we do this anymore, but this was the first official flash mob where people just organically came together. You asked people to come to a place, and then they did the same thing. Us dancing. Do people remember flash mobs? And do they happen anymore? Please use the chat for that. Next slide, please. That year, we also made a big leap. And APHA is made up of sections, SPICs, and caucuses. And sections are these units that have a lot of power. They have seats on the governing council for APHA, which you don't have as a SPIC. So we made the leap to become a section of APHA that year. We were successful in doing that. Next slide, please. Who knows this icon? I'm not as familiar with it. Is this Instagram, maybe? Next slide. Next. So this 2010 was a big year for this thing on the slide, which was like Instagram or whatever it is, because I don't really know. Somebody can help me. I don't have my notes in front of me. But this also was a year when CHWs were written into 5 different provisions. And this was one of the first federal legislation that we specifically advocated for and got CHW-specific language and funding associated with that language in the Affordable Care Act, which the full name is the Patient Protection and Affordable Care Act. Next slide, please. We also worked for 3 years to create a standard occupational code for CHWs, which is critical. That means you're included in the census. That means you're basically recognized by the federal government as an official profession or workforce. And so the APHA CHW section was, again, the lead in developing that standard, that OCC, Standard Occupational Code. But they also worked with people all over the country, and the people at the Bureau of Labor Statistics remarked that they got this was one of the professions they got the most comments for. They got over 1,000 comments from different organizations, entities, and individuals. Next slide, please. All right, so the next thing since slice spread is Velveeta. And so that was introduced in 2014. That also was the introduction of a piece of legislation or a rule change within CMS or Medicare, Medicaid, which allowed unlicensed professionals to be reimbursed by CMS. So this was the first attempt to open up the door to CHW receiving funding, the same way other providers receive funding. Next slide, please. Some of you might remember this. This was also the craze. This was the chicken sandwich from Popeyes that had people lined up, fighting in line for the last one. And I don't know if any of you guys experienced that, but I did. I was down here in Georgia by then. Next slide. That also was the year that we officially launched NACHWA at the Unity Conference, which back then was in Las Vegas. And that was after 5 years of the founders meeting for every 2 weeks with a quorum for 5 years before that official launch of NACHWA. And as you know, we're here today because of NACHWA. I think the field has benefited greatly from having a strong CHW association. Next slide, please. Next, we're getting close to me turning the mic over. And this was something, the Friends Reunion, for some people, it was a big thing. For many of us, it was not. But think about what else comes to mind that year. Next slide. our world's changed, everybody. Some of us who came into this field working in HIV remember those first days of HIV in those first years. Next slide. CHWs became this amazing, wonderful group of people who were going to help this world navigate through this atrocious pandemic. That in the early days, the myths, the not understanding what was going on was just as rich with COVID as it was with HIV. We also became the trusted messengers, helping people kind of navigate COVID-19 testing. We were getting personal protection equipment out to people, and we became this truly recognized workforce that people were now calling us essential. And this was the first time for that, so that was a big time for that. Next slide, please. So in those years, I will say this, in 2000, one of the first CHW networks was created. And since then, now we have over 60. Really, the last 10 years, CHW networks, associations, alliances, and coalitions have grown immensely. They've not only done that, they've got funding. A lot of the first CHW network associations were volunteer. You know, we had people pitching in to do conference calls, organizations pitching in to give us space to meet. Now, many of them have funding, they have executive directors, and the networks are a big part of NACHWA, and they're a big part here. And I know we have some network representatives, say, from Georgia, and maybe some of the other states here. We also, in the last couple of years, have done major advocacy on Capitol Hill. Now, mind you, for years, many states have had days on the Hill in their states. But in 2023 and 2024, NACHWA and Partners in Health, US, brought together CHW leaders to go on the Hill. We had a congressional briefing. We did Hill visits. And this is going to be happening every year in the spring. So I urge you all to get involved and engaged. Unity Conference, we're having our 24th anniversary. This might be our 25th now. We've hosted CHW Awareness Weeks nationally for the last couple of years. And also another piece that have happened with the Biden administration in particular, and that is unprecedented investment in the CHW workforce. We're talking to the tune of billions of new dollars for CHWs. Next slide, please. So I'm going to just quickly walk through my story. So imagine we're weaving our stories. We're thinking about who we are as people, what shaped us. I want people to think about the anthem and something we've said for many years, even prior to the anthem. And that is CHWs are born, not made. There's these organic attributes and qualities of CHWs. And I'm not saying that's not present in nurses and doctors. Social workers definitely have some of it, but there's this unique thing within us that kind of makes us CHWs. And then when we learn, when we get training, when we get access to information and knowledge, you know, we hone our skills. But that organic, natural helper person is really born and not made from a book or training or a certification process. My life was shaped by a single mom living in a housing development in Roxbury, a section of Boston. And she was an anti-poverty warrior. She was getting services from places who then said, can you volunteer? And that's, you know, she's the executive director of this anti-poverty agency, providing services for our entire community. And she became a state elected official, which she was for 30 years, but she held true to those key elements and that made her a really good legislator and really carrying the water for the community within the halls of the State House, which was critical for many parts of the movement. As a baby, I was brought to marches, y'all. I think as a toddler, before I learned other words, I learned to chant, the people united will never be defeated. All right, that's my upbringing. It was in my blood, that social justice movement. And I think what happened with that was, it really pushed me to say, wow, I want to be part of this. There were community meetings hosted in my home. I was one of the kids on the floor playing in the corner when community meetings and organizing meetings were happening. Everything from looking to have Roxbury secede from Boston to become our own entity, the African national movement. All these things were happening in my life that really shaped who I was as a CHW, but particularly shaped my love and passion for advocacy and policy development. I went to a community school that also helped shape me as a CHW. We learned history, Black history and other history every day. We play characters in Black history. So I have this passion for history, and I think for CHWs, I hope we can really collect and share that passion for history, particularly of our stories and of our movement. I will say that out of college, I thought I wanted to be this person who was going to get my family out of the hood and make all this money. So I went to the phone company. Those might remember New England Telephone, which became Nymex, which became Verizon years later. I'm talking about in the 80s, y'all. And I felt good with that job. I was making a lot of money, but I felt more fulfillment in doing my volunteer work with young people, which I had started while I was in college and then when I went to the job. So I shifted. I took a 50% pay cut to become a CHW back in 1991, working at a hospital, Boston Children's Hospital, but also working at a community health center. And also at the same time, yes, 3 jobs, which is not uncommon for our stories, y'all. And they're all important, working for a nighttime street outreach program. My whole world was working with CHW peer educators of adolescents and also serving adolescents living with HIV. So I did that on a clinical setting in children's. I did that at the health center as well, but also with the street outreach program at night. We had a drop-in center where we did a lot of things to do referrals and get people connected. And I'm saying this as part of my story because as we tell our stories, my story is about being able to navigate those worlds. We're very different. The world of a small community-based organization with street outreach workers on the nights in Boston, 365 days a year, y'all, even when we had storms, even when it was 20 below, we were out there because our clients were out there. And so navigating that with a teaching hospital and all the resources they have and then a community health center, which, you know, was an awesome place. And early on in my days, I learned how important I was to my story. I also want to say that for all of you here, I mean, since day one, I've been active in the movement, and I could see some of the faces earlier on. Many of you are too, and it's just a matter of articulating that as part of our story. It's talking about the work we do with our clients, but also talking about our advocacy work, which is critical. And now I think it's drumroll time. Take a breath, soak it in, think about that history, think about some of the elements I shared of my story, which I felt were important to share. And now I'm going to pass the microphone and we'll hear a little bit more.
Great, thank you, Durell. I think that's my second time hearing that timeline that you articulated, and I think every time there's a different piece of it that resonates with me. I think there's so much I think there's so much that we can glean from looking at historical development to understand where we stand today, and how it kind of traces back to all these events that have happened in the past. So, I think before we head into the next section where we talk about developing a personal story, I thought, we thought it'd be helpful to first, take a moment here and pause a little bit and think about this by the way, this isn't meant to be like an existential provoking question necessarily, but just think about, who are you? I'll say, who am I? And let's frame that in terms of, the values and customs and history that come with you, that come with me, in what brought me here and brought you here today. What are you passionate about in the work that you do as a community health worker? And then also, what are you most proud of in your work? You can think of that, in terms of recent history or even going back for as long as you like. But maybe I'll pause here for 8 seconds just for you to have a chance to think, and feel free to jot it down on a piece of paper, because I think some of this will help kind of set up the couple slides that we have coming up. Great, thank you. So obviously we're here to talk about personal story, and we've all heard some of the highlights and personal story elements that Durell has shared, and kind of kindly used as an example for us to think about. I sort of think more broadly about how we can use personal stories as a communication tool, perhaps even as a tool to advocate for change, for larger scale changes, particularly when it comes to improving healthcare and community health. And so when we think about what a personal story is, it really is simply just an account of the meaningful events or experiences in your life, right? And so as you can see here in the slide, when we think about personal stories, it really is meant to help contextualize and create shared understanding. I think it's something interesting about humanity is that we are a storytelling people, right? The way that we share information, even before they invented writing and all of that, is we tell stories, in part because these stories allow us to connect with each other and facilitate emotional connections and impact. In the context of CHW work, I think what's important about personal stories is that it gives meaning to lived experiences, and it helps to add nuances to what we see beyond just what's portrayed in numbers or statistics. So, throughout the course of this workshop, what we've tried to do is to lay out a framework for you to really think intentionally about how to create a personal story. So as you can see, we sort of humbly propose this 5-step process, right? Where step 1, you begin by first thinking about what's the key message, what's the key takeaway that you want your personal story to hit. What do you want to accomplish, right? So oftentimes we think about begin with the end in mind. What's the end goal of the story that I hope it will achieve by sharing with other people? Step 2 is you want to think about who your intended audience is and what sort of modifications you have to make to your story in order to have the best chance of resonating with their interests. And then step 3 is you describe the issue or the challenge or the obstacle, right? I was watching Avengers Endgame recently, and it very much mirrors that sort of hero plot line, right? You have these characters, and then some rising action happens, some conflict happens. And then step 4 is sort of that, what is the solution? What was done? What was the intervention that was implemented to try to address or improve that problem? And then number 5, to cap it off, is you want to reiterate your key message, and you want to end, this is really important, you want to end with a call to action. Now that I've told you my story, what do I want you to do about it? So here's a quick question for all of us to think about, and feel free to type it into Zoom chat. We mentioned, begin with the end in mind, and we want to think about what is the key message. What's the main point of information that you want the audience to understand or remember? And so as you think about your work and your identity and your experience as a CHW, what do you think is the one most salient key message, or there could be multiple? What's the key message that you want people to be able to understand, to better contextualize, to know about this work and this profession? So let me pause for maybe 15 seconds there and give folks a chance to type in their thoughts into chat if you like. Or if you want to talk, feel free to raise your hand and unmute yourself. That's also very much welcome. Yes, I see them coming in. Thank you, Kayla and Teresa. Yeah, thank you, Durell. The importance of the workforce, for sure. Well, I think in the interest of time, what I'll do is I will kind of pull together what we've seen so far. So the key messages that folks have indicated, have shared so far in chat, as you can see here on the screen. You can't do it alone. Relying on your community can help build you up as well as them. Being a CHW is not a job or a career. It's a way of life. It's a way of being. It reflects who I am as a person. I think that very much echoes some of the CHWs that we've talked to. It's a calling. It's a mission, right? And then, of course, the importance of workforce and achieving health equity, right? It's the workforce that we need for the world that we want, for sure. Yeah, and I want to invite you all I know that there's a couple that came in through chat, through Diana and Danina. Sorry, we didn't capture all of those. That's certainly your input. Walk the talk, follow through, and Koya and Philip have expressed agreement about establishing trust to better understand what issues are faced by the community. So thank you for making time and space to share your thoughts there with us. So our next question, we just talked about key messages, right? Those are the main takeaways. Begin with the end in mind. What we want people to understand about CHW as a workforce, as a way of life. I think the next question we want you to think about, and Stephen, if you could please launch the poll right now, is, in this process, we begin with the key message, but the step 2 is we want to think about who do we want to share this message with. And so if you all could take a couple seconds to think about or to fill out that poll, it'll help us to get a better sense of, who are we trying to reach here? Okay, great. So it looks like so far we have a lot of votes coming in for communities and community members. So 82% of y'all said community members, followed by healthcare, social services, and public health workforce. That's number 2. And then sort of this generic decision makers is actually the third most common response that y'all shared. So 1, 2, 3 are communities and community members, healthcare, social services, public health workforce, and of course, decision makers. Yeah, thank you. Oh, I have a share results button. So hopefully you can see this pop up on your side as well. Thank you for voting. Voting is cool. Okay, let me close this and continue on. And just to say that, I think there are a lot of reasons why your target audience, your intended audience might be interested in the work that you do as a CHW, right? You can see here we've identified 4 boxes for you to consider. Obviously, I think there's going to be a lot more, but I think they fit into these 4 categories. The first one being that CHWs have close ties to the community and sort of have their finger on the pulse, and therefore can have insights that can help inform policy and stories that can help influence decision makers and different constituents. I'm reading across here. The second box there is that CHWs can often serve as a bridge between the healthcare system and community members and help build community trust and resilience. I'll go down clockwise there. I think the third bucket is that CHWs are trusted members within the community that can help provide referrals. I know Durell mentioned referrals as being part of his story, connecting people who are in need of support and information to the resources and folks that can provide those services and support. And then the last box is that CHWs are valuable partners that can help connect patients to resources. So I feel like I'm preaching to the choir a little bit, but just to say that in the work that you do as a community health worker, I would argue, I would humbly submit to you that there are many reasons why your community members, policymakers, decision makers, and other people working in the health and social services space would want to know more about these key messages that you have. So here's a quick question for us to think about in chat, and feel free to, would love to see you type it in as well. What issues, maybe they're health issues, social issues, whatever they may be, are they faced by your community so currently? Maybe we'll give it 15 seconds for folks to provide their input. We're trying to keep an eye on the clock here a little bit. Yeah, so Philip is calling out healthcare equity. Absolutely. I think that's become clearly a national priority. Genevieve mentioned lack of mental health resources. Absolutely. I think what we see is that this behavioral health, right, the intersection of substance use and mental health oftentimes create really dire needs, needing more providers, needing more facilities, needing more funding. Durell mentioned diabetes, hypertension, violence. Absolutely. Alejandro mentioned language barriers, of course. Without being able to understand and make use of information about health, it's difficult to make informed decisions. Danina mentioned affordable housing and pay equity and earning a livable wage to survive. Absolutely. Housing, healthcare services, chronic diseases. Yes, Amari, thank you. I think that really resonates. I think we all know the words social determinants of health or social drivers of health, right? And so, yeah, healthcare navigation, Philip just added there. I would also submit probably healthcare literacy or health literacy is a big component of that. So great. I think I will skip this slide because we're sort of calling it out here. Koi also mentioned access to healthcare, transportation services, especially the elderly and disabled persons. Absolutely, I couldn't agree more. I'm going to hand this off to my colleague Rachel right now to sort of talk about key points. And then again, just want to say thank you for providing your thoughts and input into chat so far.
Yes, thank you. And thank you, everyone. And even if we're not showing them on the slides, Cynthia and Emma are capturing these and putting them on our slides. So once we have the slides together, we'll be able to kind of share all of these, even if we aren't able to kind of call them out as we thought. But, you know, I think that when we're thinking about all of these problems that you list, these are obviously problems that can impact the whole community. And when you're thinking about the audience that you picked, and I know a lot of you talked about communities as your main audience, why are they going to care? And how are you going to situate this story and make it interesting to them? And so I think obviously a lot of the issues that you said directly impact the communities in which you serve. And so right away, when you're situating a story, if you are going to situate it in these issues that they care about and tell an impactful story and about how you're working to address these problems, that's a connection that you have with the community. And presuming you live and work in this community, you might see this every day. You might have some of these challenges, you have friends and family that have these challenges. So that helps foster that connection that Michael was talking about earlier. And, you know, also I think depending on the audience, especially if you start talking to more audiences such as politicians, situating these in numbers too. You know, you might start a story and put the context in that you have a food insecurity issue. You know, it might be that you're going to give more of a picture of what's going on and give an example, give a concrete example. You know, someone who's an older adult, they're really struggling for food. And then now they've been diagnosed with cancer. So they're already food insecure. They've got multiple issues. And then now they also are going to have to struggle with the healthcare system. So you could really kind of pull in this scenario and bring people into this environment and probably connect it with people that they know also. Next slide. And as Michael mentioned, a lot of these key challenges that are particularly getting more recognition in the communities and political circles, and I think just more of a word of interest or term overall, is social determinants of health. And these are all of those kind of non-health, non-medical related functions and concerns that can impact health and well-being. And so you see a lot of what you've mentioned as challenges in your community is in this slide here. And all of these social determinants are key things that CHWs address. And, you know, I think that this is a crucial part of the story as well. CHWs are not just making medical referrals. They're making referrals that impact the whole person and help them be set up for success in all of those factors that surround health. So I'd encourage everyone to look at this slide and think about what are you doing that falls into these categories. And yes, I hope that we can get copies of the slide. And maybe I know this is being recorded also, so hopefully we'll be able to get those to you afterwards. I think in the interest of time, we'll just go to the next slide. And so just thinking, and this is going to set us up for a few more minutes of discussion. So how have you been able to address these issues in the communities? I know a lot of you put it into chat before. What kinds of things? Are you giving referrals? Are you helping people in other ways? Like, how are you addressing those issues? What is your work as a CHW able to do? And I know we only have 6 minutes left, so I would really encourage everyone to put these issues in the chat so everybody can see. And like I said, we can gather them. But Michael, I think we'll just go ahead. But please do put these issues in the chat so we can see, what do you feel like your most important work as a CHW is? So we'll just kind of go to the next slide that has content on it. And what we wanted to say here is, in a lot of our conversations that we've had with CHWs and with others, it's, you know, something that you might see as something little. Like maybe people think CHWs give health referrals, or they do referrals. They have this, and you think of this formal definition, these big impact outcomes that CHWs might get to. But all of these small actions, you're just paying a little bit of gas out of your pocket to go visit someone, or you just go to festivals because you know people like to see your face and might ask you a question. Next slide. Can lead to big impacts. So you're paying for gas out of your own pocket, and then you're also able to get your impact and give people food they need. You're able to travel out to rural areas and help people. You know, yes, maybe you might say, go to community festivals, but you're building trust. You're in that community. You're saying, I'm here, I'm a part of your community, and you're doing all this work. So in addition to all those big picture items, those small things matter and they add up. And we want to make sure, as a key point and takeaway of this discussion, that you realize that all of those things you do matter and can figure into your story, because a lot of this is what makes CHW so special and able to have the impact that they do. Next slide. So just to give an example from the field, this is a real kind of fictionalization of an example I heard, not to give away any exact names, but I heard that there was a CHW working with a client. And the way this was so impactful to me is the person would go to visit the client. They had a lot of distrust in the medical community, but they knew this person needed a lot of help. The person would only let them up onto their porch. And so they went, and week after week, they go talk to someone on their porch. And over time, the client slowly let them into their home, and they were able to see that she was living on 1 can of food a day. She had multiple comorbidities, lots of trip hazards and things like that in the home. And there was a lot of help she would need over time. And slowly they were able to help this person and get them the resources that they need, and then ultimately get them into a safer housing situation. And so next slide, please. But I just want to use that as an example of what an impact that made. And it wasn't just tick another person getting a referral or tick another person in a housing development. They spent time, they built trust, and maybe they drove a long way every week just to see this client. They sat and talked on our porch, and all of these words and actions to kind of illustrate what all this value add that you're doing to kind of get to these points. You connected them to programs, yes, but after a year, you were able to move them into facilities. So this is kind of an example of a specific case. If you have that one client or one person that you've helped that really made an impact, and you can kind of situate that as a bigger story to help everyone. Okay, I know we've got 3 minutes left, so I'm going to try to race through what we have. So let's see the next slide. And thank you, everyone. I hope everyone's taking a look at the comments. And I will hope that our facilitators can get them on slides so we can share out all of these great comments. And just to say, when we think about what we're doing and what we're gathering, it's really, we're trying to tell this story. And I know a lot of people hear the word data and just kind of recoil in horror. But you think about it, we don't have to use big, huge statistics. Oftentimes it's, I drove 25 miles. I've been with this person every week over a long period of time. Like, how can you quantify all of those things that you're doing in a way that will be meaningful for your audience? And especially if we're talking about building trust, building referrals, it's not just that endpoint, it's all of those things along the way. Can you give some information, some numbers, or even those detailed descriptions of how you've really helped? And I think we want to make sure that your contributions are valued and that they can be elevated, because even those small things that are small to you are a key part of getting those big main outcomes and impacts in your communities. Okay, next slide. And for this one, I think we've got 2 minutes, but I do want you to think about this. And please also, this is where we get to the ask. This is kind of, and thank you. So Cynthia's put that in the chat, so maybe we'll go on to the next content slide, Michael. So please feel free to put those in, because I want you to think about, what do you really need? Like, if you're going to do all these things in your community, what are those tools do you need to have more awareness in the community? Are you really talking about, I know someone in the chat before said we need those workforce supports to really be able to do our jobs. Are you going to the Day on the Hill to advocate for a new policy? And so, when you're thinking about this story, and this is kind of that beginning and end kind of going into each other, it's like, what is that key message? And what is that action? What are you leaving that audience with? And for a community audience, maybe it's just that increased awareness, or helping facilitate that trust to illustrate all you do, that we're here for you, we understand, here are those stories. And so, it might just end in a kind of an ending statement of why CHWs are so important. And for other audiences, maybe it's, I need more support to continue doing work like this. And so it's really trying to think, what is that kind of thing you can end with? Is there a call to action? Is it you've helped them learn something? Is it they need to go put a bill in or vote for something? Or maybe we need to take a look at our workforce policies to make sure this workforce is supported. So that's just such a key part that I think can be impactful. And I think we'll just go to the next slide. And I think this is pretty appropriate. I've got about probably 30 seconds. So I just wanted to say also, if you can get that bigger story and think through these parts, can you distill it down to something like an elevator pitch? This is 30 seconds to a minute, like you're in an elevator with someone. What are those really distilled down key facts of your story that you can really tell to someone, probably a politician? You have a short period of time. Think about all of these stories and all of these really impactful things that you've done, And what is that one key fact or one key point? I know Durell said he's gone out in blizzards. I'm sure that you could make that into a hook that, you know, I've been out in blizzards and, you know, I've trudged through 5 feet of snow to get to someone. And you could really make that a story and say, people still need these services. This isn't stopping. And I really, at the end, this call to action, please vote for, please put this bill on the floor and things like with no boots on it. Yeah, Durell, there you go. Uphill probably both ways, I would think too. But just kidding. But yeah, I'm sure that like that story, I'm sure that could be a very compelling, longer story and really distilled down. And I'm not sure if they kick us out right at 4, but I really just hope that everybody can take away from this session. Don't really think, I'm happy to stay on. I know that we are too, if people would like to stay and chat for reflections. I don't really know if we have a hard end time, but I really think it's important to know that your story matters. And it's not just the big ticket items. Even if you don't have one specific case, think of all the things you did, all the times that I'm sure Durell walked through snowy Boston weather over and over just to make sure he saw the people that needed it and other things. So Durell, I don't know if you want to have a brief summary and takeaway. Oh, thank you for starting putting some of those in the chat. Thank you all for you, Durell.
Yeah, open the mic. Anybody want to share anything? Things that we didn't get to, you will have access to. Anybody can email any of us that you know. You can put your email in the chat. But not to, I believe we'll be making slides available. And there are some pointers and tips that I think are really good tools that are offered, as well as some resources. But thank you all for this. Shout out to everybody who's here. Anybody can unmute right now and just give a final closing remark. Any team members?
Thank you everybody
Rachel,
for joining. Yeah, thank you everybody. Have a great day. Thanks.
Aloha. And now it's break time officially for the conference, and they will reconvene at 4:15 in the main room. Thank you, everybody. Yeah.